Thank you for joining me for this orientation video today on NeuroCranial Restructuring. This video is meant to be watched by those who are new neurocranial restructuring patients, for those who are more interested in just learning about NCR, or for those who are possibly going to be getting NCR in the future. This orientation will be fairly basic and go over some history, some anatomy, and what's going to happen during the treatment itself. So to start, I always start with my own personal story. I was born in the 70s, let's say, and at that time I was a forceps baby. And what that means is that when I was born, my mother, they used forceps on her. And so, because my head was too big to get out. And as I grew up throughout my life, I had my teeth grew in crooked, and I had chronic headaches was my biggest complaint. And I think that I just thought that chronic headaches was actually a normal part of life, because I think I'd had them since I was so young that I didn't realize that it was not normal to have a headache. And so when I got in my early 20s, I was a massage therapist north of Seattle, and I had a practice and was pretty busy, but I was in chronic pain all the time and was going to the chiropractor 2 or 3 times a week. I had cut all the allergen foods out of my diet. I was seeing an acupuncturist. I was just doing everything, and I was also taking pharmaceutical painkillers to help my headaches. So in 1996, I met Dr. Dean Howell through a mutual friend, and he was referred to me, and he came to me as a massage client. And then he started asking me, well, do you feel okay? And no, not really. Now that you bring it up, I have this chronic headache all the time that I wake up with and I go to bed with, and blah, blah, blah. And he said, well, I can help you with that chronic headache. And when he told me what he was going to do, I said, oh, no way, I would never do that. That sounds weird. And after about 4 months of working with him and seeing what he does and realizing that nothing can be worse than having a headache every day, I decided to do the neurocranial restructuring. And literally after the first day of treatment, it changed my life. I did a 4-day session with Dr. Howell. And for the first time that in my life that I could remember, I laid in bed without a headache, and I woke up without a headache. And so I was so excited that somebody had finally taken the vice grip off of my head, was the only way that I could explain it. And so in 1997, Dr. Howell got very busy in his practice, and he offered me a job to come in and be his assistant. At that time, he hadn't had an assistant, and so I was his first assistant, and I was so excited about the work that I sold my practice, and I went in to work with him and worked with him side by side for many years, and then finally decided that I wanted to be a doctor who did this. And so I went back to school, finished my bachelor's degree in Whole Foods Nutrition, Bachelor's of Science in Natural Medicine with a pre-med emphasis, and then I went into the naturopathic medical program at Bastyr University in Seattle, and I did the 4-year program, and I've been practicing on my own since 2007, mainly specializing in neurocranial restructuring. So today we'll just talk a little bit about the anatomy and then the conditions that I see most. So here's our skull, okay? And you'll see too, there'll be some slides on here with PowerPoint, so you'll see some better anatomical views. But in the skull, we have 30 plus joints, and we have 22 bones. And in the very center of your head, at the back of the eyes, you can see there's those holes, right? Oh, my head's gonna fall apart here. Hold on. These holes, that's where the optic nerve runs through. That's your sphenoid. Your sphenoid bone is the bone that we're adjusting in neurocranial restructuring. And the sphenoid bone is actually attached to 19 of your 22 bones. So all but the mandible, which is your jawbone, and the 2 little front nasal bones right here. Those aren't attached, and your jaw's not directly attached. But every other bone in your head is attached. And so the reason we work on the sphenoid bone is because it attaches to all those other bones, and when you move it, all the other bones move. The skull also sits on the spinal column, and it sits on C1 by these two little condyles right here. You can kind of see them. They're right above the hole here. Those two little condyles are what your head sits on your neck. And so really, it's not a whole lot of space. So people have normal neck curves and back curves when their head is sitting on properly on that C1 condyle. But what happens when people get whiplash or a head trauma, they get a whiplash injury, and what happens is the head can slide forward or even sometimes back on that C1 condyle. And then what happens is their neck curve, which is naturally what we call a lordotic curve, it will change to become a reverse cervical curve to hold the head up. And what is usually sacrificed when that happens is range of motion, because now the muscles are holding up the head. People lose range of motion in their neck usually acutely after a car accident or any kind of whiplash injury, and that's so that the muscles can keep the head up, because the skeletal system is not doing it as efficiently as it should. And so the entire skeletal system, the skull, and the spinal column all work together in order to give you proper alignment. The next part of the anatomy that we're going to talk about is the meninges. The meninges are thick connective tissue that line the inside of the skull. So they line the inside of the skull, which you can't see here if I start taking my guy apart, but it's all inside. This is where your spinal column comes out. It's all inside here, and it's 3 layers. So one layer is around the brain itself, and then the other 2 layers are close, it's closer to the skull. And between 2 of the layers is where your cerebral spinal fluid moves. And so that's called the arachnoid space. And the meninges, when you're born as a baby, when you come through the birth canal, the head actually is squeezed. So I'm going to take this guy apart because she's falling apart. Hold on. Okay, so now we just have the top of our head, and you can see the sphenoid really well right here. You can see the wings of the sphenoid here. And then what comes right out of the sphenoid? That's your septum. Yeah, deviated septum. We'll talk more about that later. So the meninges are inside the head, and when you come down the birth canal, your sutures actually cross a little bit because your head's so soft as a child. They cross so that you can get out, and once you come out, they start to uncross. Once the baby's head is completely out of the birth canal, then what happens is the sphenoid bone goes, oh, okay, we're out in air, and it starts to pulse like a butterfly. And so it's called the butterfly bone for a reason, because it's doing this kind of action all the time. And when the child comes out, the sphenoid starts to move, and then the meninges, which are this thick connective tissue, they start to move as well. And what they do is they kind of do this action like this, and they're moving. And so that's why a child who has this crazy cone head when they're born, they eventually, over a couple days, their head will round out, hopefully, and become smoother in those joints. And that's the meninges and the sphenoid working together to do that. The meninges also comes out of the skull and lines the spinal column all the way down the spinal column, and so it's protecting the spinal cord. And then it comes out along all the peripheral nerves out of the spinal column and goes all down the arms and the hands. So a big population of people that the old-time docs who did this treatment, they worked with cerebral palsy. Cerebral palsy has a lot of connective tissue disorder, parts to the disorder. And so when you work on a child with cerebral palsy, when you relax their head, their meninges work better, and their feet and legs can actually relax. And the contractions that you see in cerebral palsy, they relax. And that's because that connective tissue that's inside your skull and lining your brain and protecting your spinal column is also the same connective tissue that's going down your arms and legs. And so by changing the shape of the head, we can actually change the pelvis, the back, the pelvis, and the feet. It's kind of crazy. But that's the meninges. The third part of this is the cerebral spinal fluid. So in that arachnoid space, you have the cerebral spinal fluid. And the cerebral spinal fluid has got immune cells in it, white blood cells in it, it's got neurotransmitters in it, and it's really essential for proper immune function and health, brain function. When somebody's had a head trauma, like let's say to the frontal lobe, and their skull goes in and then their brain has a whiplash, or what we consider really a minor seizure, this area of the skull may be compromised, and there may actually be less room in there after the accident for the cerebral spinal fluid to get around. And so sometimes with accidents, almost all the time with accidents, once the acute phase is over, you can see lingering depression, anxiety, and a lot of mental things, and sometimes frontal lobe disorders, because this is like the rational part of your brain. It's where you have emotion. It's, these kinds of things, so people can have emotional outbursts and be, not themselves after they've had a trauma. And so by changing the shape of the skull and making it more symmetrical again, you can actually improve the saturation of neurotransmitters and immune cells and stuff by the brain. So people feel better. And that's without giving them any medications or anything. That's just with changing the shape of their head and making it more optimal for them. So we have the skull, the spine, the pelvis, and the skeletal system. And then we have the meninges, the sphenoid. Oh, don't forget the sphenoid. And then we have the meningeal system, the cerebral spinal fluid, and as a unit, all of those are working together to make you a healthier person. So a few of the conditions that I work with. One condition is headaches. So there was a big research project that came out from the CDC a couple years ago, researching children that had headaches, and they decided that they were going to go and find all these, find out what happened to children who have headaches. And they found out that there's a lot of children who have headaches, and these children that have headaches, they not only don't feel good and they have poor quality of life, they tend to have more problems like hyperactivity, anger and aggression issues. They act out more, they steal more, and they lie more. So a lot of frontal lobe behavior is going on in these children who complain of chronic headaches. Now, the conclusions of this study, they weren't really sure. They said, well, we know that these children, thousands and thousands of children are having headaches, but we don't really know why, and so this is something that needs to be researched more. So yeah, I see a lot of adults who were children with headaches, and I'm an adult who was a child with headaches, and so I tell people, if you have a child with headaches, we need to rule out all the reasons they could be having headaches. And if they're still having headaches, we need to look at their birth. What was their birth like? We need to look at the accidents and the falls and the sports and the things that they're in. I have an 8-month-old daughter. She's hitting her head all the time. It's driving me crazy. But that's how you learn to walk. That's how you learn your world, and you fall, and these things happen. And sometimes some children just don't bounce back as well from it. And so you can have things that are impeding on their nervous system. Now, in my case, I had lots of falls as a child, so it could have been that. It could have also been the forceps. And so I say to parents, if your child was born with forceps, if they had a long labor, sometimes too fast of a labor will also cause the same problem, or they had suction cups, and even children with cesareans. Sometimes the cesareans can be pretty brutal on the head. So I tell the parents to bring them in as soon as possible. Why wait until they're an adult with headaches? I also see a large group of people that this therapy was originally designed for is chronic sinusitis. So breathing is really not overrated. Breathing is pretty important, and a lot of people cannot breathe efficiently through their nose. And so there's things like sinus surgery, there's things like deviated septum surgery, but really those surgeries are only about 50% effective, and any surgeon will tell you that when you elect to go get those treatments done. So what this therapy can do is it can actually go in, and we're not going into the sinuses, we're just going into the nasal cavities, and we're just pushing on the sphenoid bone. By moving the sphenoid bone, that's going to change the dimension of the nasal cavities, and it's going to improve the space in which the sinus tubes coming out of the sinuses, which are these big pockets basically in your skull that hold fluid, and it's determining how they're going to drain. The other thing is if your nasal passages are really narrow, you're not going to be able to get air up through there efficiently. And breathing's really important because people don't breathe properly. They have more sleep apnea. They have like oxygen deprivation, really. They have more fatigue. They have more allergies. They're not able to clean out the air that they are breathing. And headaches and depression, and I see all kinds of things from just not being able to breathe efficiently. And so that's a big population of people that I see. People that have had chronic broken noses, athletes that have had multiple broken noses, multiple head traumas. Remember, head trauma too shifts your head, and when your head shifts, the area in here is going to shift. And so that is that's a big population of people that I see. So if you're considering sinus surgery, you should do this first because it's no drugs, less money, less time, no healing, and breathing stuff is pretty immediate. So I would recommend this first before sinus surgery, and if it doesn't work, you know, surgery is always an option, but that's what my protocol would be. The third group of people that I see a lot of in my practice is scoliosis. So the question is, well, how can scoliosis be changed by this? And really, you think of it like physics. It's pretty simple if you think of it in physics terms, is that you have a ball, a big ball that sits on top of your skull. And this big ball is really heavy, okay? And this big ball has the most important organ in it, which is your brain. And when you have a head trauma, let's say, you have a head trauma, and now your skull has shifted, your brain has been compromised a little bit, and your nervous system isn't working as optimally as it could be. What you start to see is the head bones will rotate around the sphenoid, around that axis. And when that happens, the spine starts to rotate. And it just makes sense because if you take a big ball and you put it on a straight stick, it'll spin, and usually it spins without falling off. But if you rotate that ball, if you make that ball a really strange shape, you can't put it on a straight stick. You have to curve the stick. Now, we naturally have curve for a reason. You need curve. I see a lot of people that have no curve. We call it military spine. And they have as much pain as somebody who's got scoliosis. Actually, I see more pain with military spine than I do with scoliosis. Scoliosis classically is not a super painful condition, but it causes a lot of organ problems. It can cause breathing and heart issues, digestive issues, and it's a self-confidence thing. A lot of people with severe scoliosis, there's, a somewhat of disfiguration. So, but you do need some curve. However, remember, you're twisting this head, the stick's going to twist. And the reason for that is because your brain is in your skull and your eyes are in there and your balance organs. Your balance organs need to be able, your eyes need to be able to see the horizon, and your balance organs need to be able to work good to keep you upright. So your nervous system doesn't really care if you get twisted and your head twists and your body twists. All it cares about is keeping your head straight and keeping your eyes on the horizon and making sure you can walk without being dizzy. You don't ever see people walking around like this. I mean, people walk around like that. People can't walk around like that. You can't function like that. And that's your brain. And so scoliosis is really about shifting the whole body to compensate for the shift in the head. And I've seen amazing things with scoliosis in all different degrees. Now, it's not going to completely, if you have a 75-degree curve in your back, it's not going to completely cure your 75-degree curve, but it's going to improve your quality of life because it's going to decrease pain, it's going to improve your curve some, and it's going to take some of the pressure off of those organ systems that are really affected with severe scoliosis. And you can go to some of my testimonials, and I have some scoliosis patients on there who not only looked better, they mentally felt better, because when your brain is being squeezed and twisted, it doesn't feel very good and it doesn't function optimally. So I'm really excited about the results that I see with scoliosis. Now, this treatment can help a lot of things. It's also important to remember that it's not a cure for a lot of things. So NCR is not a cure for Parkinson's disease. It is not a cure for multiple sclerosis. However, I have patients with those disorders or diseases, and their quality of life is improved, because when you have Parkinson's, you are having decreased, your gait is shuffling, you're having more drooling, you're harder to understand. These are all brain functions, and we know these: dopamine, deficiency, etc. But when you change the structure, you can actually improve what is going to work and have it working better. So people don't shuffle as much, people don't drool as much, and so you can improve quality of life. Same thing with MS. You can keep somebody feeling in a good quality of life without, without making them feel, like they are stiff and rigid and all that. I mean, you can really improve somebody. And also, I have people that are more advanced in wheelchairs, and sitting in a wheelchair is uncomfortable. And people in wheelchairs develop scoliosis. They prop their heads up. Their eyes don't like to be over either. So just like a person who's weight bearing on their legs, somebody in a wheelchair can get as easily structurally messed up as somebody who's standing. And so I have a lot of good results with people in wheelchairs and improving the way they sit and improving their scoliosis and the way they feel. Just a little bit of history. Osteopaths were the first kind of head doctors, and they dealt with the cranium. And osteopaths, the main osteopath that we hear a lot about is Dr. Sutherland, and he defined this thing called the primary respiratory mechanism. And this was in the late 1800s, so this guy was really ahead of his time. And back in the early part of the century, osteopaths were kind of considered whacks, like naturopaths are today. And so, osteopaths were doing a lot of cranial manipulation. The treatment that we do, the NCR, really was started by chiropractors and naturopaths in about the 30s and 40s. And the original